Now to that growing and disturbing trend, the disproportionate impact COVID-19 is having on communities of color, from New York to Detroit to nearby Baltimore, where I drove this week to see for myself. Baltimore is a majority Black city that's seen more than 750 infections and 22 deaths so far, and it's about to get worse, labeled as an emerging hotspot for this deadly virus. The streets of this city are nearly deserted as this virus zeroes in on Charm City, home to Maryland State Delegate Nick Mosby, who is concerned about higher rates of death for people of color across the state.
When you look at it from a socioeconomics perspective, there's always been healthcare disparities in the African-American community.
Part of the district he represents is seeing a spike in infections, and he is especially concerned for essential workers.
Some of them do not have the ability of social distancing because they rely on public transportation to get to and from work. They work in environments where they're the front line.
According to the Economic Policy Institute, fewer than 1 in 5 Black workers and 1 in 6 Hispanic workers are able to work remotely.
They're the bus drivers. They're the folks that are cleaning our hospital floors. They're the folks that are working in our grocery stores.
Like 27-year-old Leilani Jordan, who died from COVID-19 on April 1st. She worked at a grocery store in Largo, Maryland.
But there was nothing that Leilani wouldn't do for anyone.
Jordan's mother, Zenobia Shepard, tearfully told us her daughter was eager to keep working.
It wasn't the money. It was helping people, loving people, making a difference.
Black Marylanders account for a majority of COVID-19 deaths across the state at 52%, even though they make up just 31% of the population. Similar numbers in other regions. Michigan, where 41% of deaths are among Black residents, who make up only 14% of the population. Louisiana, where Black residents make up 70% of deaths, 32% of the population. And in New York City, Latinos have also been overrepresented, making up about 34% of deaths there.
These racial differences aren't due to some inherent characteristics of people who are classified as Black or Latino, people who are descendants of people who were enslaved in this country, have a history of being mistreated. To just say that these are people who've made a series of bad choices and that's why they're sick, leaves out a whole other side of the story.
Back in Baltimore, Delegate Mosby wants the state to start collecting COVID-19 data by zip code to see which already underserved neighborhoods need the most help and to better protect any workers who can't stay home.
Everyone's relying on them. What are we doing to protect them?
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.